Ever wondered whether there's a link between spironolactone and an increased risk of breast cancer? Well, you're not alone. This question has been asked time and again, sparking numerous studies and debates among the medical community. The concern about a possible link between spironolactone and cancer risk dates back to 1975. Studies conducted back then showed that rats which ingested spironolactone at doses 25 to 250 times the human exposure dose developed several types of tumors over a 2-year period. These included benign adenomas of the thyroid and testes, malignant mammary tumors, and liver growths. However, it's important to note that these findings don't necessarily translate to humans. Over the years, several studies have been conducted to investigate the potential link between spironolactone and breast cancer risk in women. In 2017, a study by McKinsey examined the risk of cancer among users of spironolactone. The study involved over 74,000 patients exposed to spironolactone between 1986 and 2013. The conclusion: there was no increased risk of cancer in spironolactone users. In 2013, Bigger published data from a nationwide prescription drug registry, specifically looking at the risk of breast cancer in female spironolactone users. After studying over 2.3 million women, the authors concluded that there was no evidence of increased risk with spironolactone or furosemide use. Earlier, in 2012, McKinsey published a retrospective cohort study evaluating whether exposure to spironolactone treatment affects the risk of incident breast cancer in women over 55 years of age. The study involved over 1 million female patients, older than 55 years and with no history of breast cancer. The conclusion? The use of spironolactone did not increase the risk of breast cancer. So, what does all of this mean for you? The evidence to date does not suggest an association between spironolactone and breast cancer in women at low risk. However, many physicians continue to avoid prescribing spironolactone to patients with a history of breast cancer or those at highest risk of breast cancer, given that no such studies have been done. In conclusion, for most women, there is no evidence to suggest that their use of spironolactone increases their risk of developing breast cancer. Remember, medical knowledge and recommendations continue to evolve. So it's always a good idea to have open, informed discussions with your healthcare provider about any concerns or questions you may have.